Hey everybody, thanks so much for joining us tonight. I am Carmen David. I'm an aortic dissection survivor and aortic athlete. And Jack, who's normally with us, is going to be joining us in just a moment. But tonight we have a really great story to tell. And here's Jack. He's joined us.
Turn your microphone on.
Jack, I was just introducing myself and just saying that tonight we have a great story with a marathon runner who was diagnosed with a large aneurysm, and everything that followed is what we're going to talk about tonight with our friend Brad Way. So
we
welcome,
sure
Jack.
do,
Welcome,
Carmen. welcome, Brad. Good to see you.
Yeah,
hey, Brad, we're going to get to you in a minute. Hold on, we got some things to cover here. Carmen, how are you?
I'm doing okay. I'm hanging in there. We started that 7 Summits challenge, and I'm trying to get a little bit more motivated to move. I'm kind of trying to focus on a diet change currently. But I went about 6 miles on my latest hike, so I thought that was pretty good. How are you doing?
I'm doing fine. We'll hear about your diet later. Maybe we can have a diet show. And I'm hey, I had a CT. I'm stable. 6
All right.
months.
Awesome.
And did we say, Carmen, that we are aortic dissection survivors and we are aortic athletes? We've got another one on here too. But before we get to Brad, we want to remind everybody to click like below, and that'll help more people see this video. And also, we want everyone to join our Facebook group called Aortic Athletes, going towards 800 members worldwide. And doing climbing mountains virtually together and all kinds of fun things like that.
Well, we're almost, everybody's doing great on the Summit Challenge. We're almost to the top of the first one, which is Mount Everest. And so everybody's doing good. But just know, everybody, that we at Aortic Athletes are always following the science with the exercise and aortic disease. And our motto is to don't quit, adapt. So,
Right. And we always want to say at the beginning of these things, check with your cardiologist. We believe in joint decision making with our cardiologist. We follow the science. And so what we're going to talk about today, not everybody should run a marathon. Some special people do, but not everybody does. And we all know that everybody has a different experience with the aortic disease. And we want everyone to be safe within the confines. And within their own confines, everyone can find a healthy way to exercise, right?
Exactly. Well, tonight we have Brad Way here with us. And Brad, we're just going to start talking with you tonight about your experiences pre-diagnosis of your aortic aneurysm. And we'll just go over some questions right from there. Is that okay?
Yeah, sounds great.
Well, first, I want you to just introduce yourself and start by telling us a little bit about your background as an athlete. You know, if you ran in high school, or just give us a little background information.
Yeah, I'm a little different. I started running actually in my early 40s. I'm 52 now. And the reason I started running was we had our son 11 years ago. And I realized quickly when we had him that time was tight. I'd always been an active person. I was not a runner growing up. We just played a variety of different sports recreationally, and decided in my 40s I really had to kick into gear and get intentional with working out. And then the winter went by, and I realized how motivational the training was for me. It really got me kind of in the groove of training, and really enjoyed the training process. So I signed up for my second half marathon a year later, and shaved about 10 minutes off my time. So I, at this point, was now kind of curious what I could do if I kept working at it. And so that's kind of how I kept proceeding.
Awesome. So was there like an emotional tie? Was it a stress reliever, or is just you enjoyed it and the camaraderie with the people that you met?
At that point, I was just running by myself. I hadn't really met a running community yet. I think it just gave me a sense that I was being active. I didn't have a lot of time between work and family and everything. So it really, I think, helped me feel, just positive about my 40s and just moving and making it happen,
Yeah.
And Brad, hey, when you talk about your time, like what kind of times were you running? Where did you have goals? Like, where were you at? I'm a duffer, I'm always amidst the backpack.
Yeah. Well, my first one, I picked an even number of 2 hours for no reason other than it's 2 hour half marathon. And I had no idea if I could do that or not, but I ran a 1:49. And so I felt pretty good about that. And then the next year I shaved 10 minutes off of that. And then the following year I shaved another 10 minutes off of that. So that's kind of how I progressed, and just trying to figure out. I was a better runner than I ever knew I would be. So I just kept pushing it.
What did your goal for qualifying for Boston Marathon come in? Where did that come in?
Well, so after my third year of running half marathons, I was figuring out that I was probably Boston was a potential target if I was going to run a marathon. I thought, well, maybe I could run a marathon and then qualify for Boston. I didn't know if I could qualify, but based on my half marathon times, I was certainly, it wasn't unreasonable, but I didn't know because I had never done a marathon. So that fourth year I ran the Cleveland Marathon. I did qualify for Boston, but I did not get in because I didn't have enough time to beat the cut, so to say. So I had to think about it again.
So Cleveland was the first one, and then Boston was going to tackle the second one.
Actually, 2017 was Cleveland. Then in 2018, I had a stress fracture trying to train, so that didn't work out so well. And then the following year, I said, I'm going to do it, and I'm going to get there. But Boston had a lot of people that were getting cuts, so they actually took 5 minutes off the standard. So I started to wonder if I could make it. And then I ran the Toledo Marathon in 2019 and shaved about 9 minutes off my time. So I was able to get under the cut, and technically I was into the marathon at that point.
What was the qualifying time in Boston? Boston's become so competitive.
Yeah, I had to run under a 3:20, and so I ran a 3:14.
Wow, that's really impressive.
I was very
impressive.
Very happy once I got there. That was a good feeling to achieve that goal. It's something I wanted to do.
And why, Brad? Why? What was it about getting to Boston?
It's a great question. I think just as a distance runner, it's a destination that I think a lot of people set as a goal. I learned that I was a better runner than I ever thought I would be, and so it just really seemed like a stretch to both run a marathon and also really stretch to see if that's something I could achieve. And for me, it just kind of kept me motivated as part of a target or a destination of trying to achieve that goal. I really only planned originally to run one marathon in Boston, be done, and retire. So it didn't quite work out that way, and we'll go into that part of the story. But that was my plan.
Well, so you had this great experience. Toledo, you qualify for Boston. How far in advance are you? How long away was it when you got your qualification until you were the next Boston Marathon?
Well, so I qualified actually this last Sunday here in Ohio was the Toledo Marathon. So it's always at the end of April. And so that would have qualified me for the following year. I would have run in 2020 as I would have registered in the fall and then run in April of 2020 is what the plan was.
And something weird happened in 2020.
That was the beginning of some strange times.
Yeah. So you're a perfectly healthy person. You've got your wife and your kid. You're going to work every day, and then just bam, you get diagnosed.
Not quite like that. What happened was that was 19, and so in the fall of 19, I did apply for Boston Marathon. I got my letter that said I was accepted, and if everyone recalls back then, in January is about when COVID really started catching everyone's attention. And by, I would say, February or March, things were being canceled. So the Boston Marathon was canceled in 2020. And my life was still normal as far as my health goes. That just all the races were canceled. So then a year later, they had delayed Boston on 2021. The spring marathon was moved out till October with the hope that COVID would be at a place where they could actually have the marathon. So I was waiting patiently to reapply in the spring of 2021, and that's when I was diagnosed.
Wow, Brad, you know what? We would have. I had a charity number to do Boston in 2020. We would have done it together, unknowing what fate awaited both of us.
Jack, I think we both almost crossed paths at the clinic too. So maybe you and I should just we should stay out of each other's path.
All right. So what happened? So the world's your oyster. You're qualified for
Yeah.
Boston. I'm sure your family thinks this is a great thing. And then what happens?
Yeah. So it was March. Is March. We headed off to spring break down south to Hilton Head. Came back from vacation, and that night I remember Sunday night in late March of 21, I got pretty sick at about 1 o'clock in the morning. And of course, at that time, the first thing I think of is I've got COVID and this isn't good. I hadn't had it, as a lot of people hadn't had it, but that was what was on my mind. So I did what you were supposed to do. I quarantined in the house to a different room. This is all in the middle of the night. And somewhere in the middle of the night, I felt like I was going to get sick. I went to go to the bathroom and I passed out, which was really unusual. And so actually, I think I passed out a couple times, but I was obviously experiencing some syncope. So my father-in-law heard it. He was very concerned, woke me up, and I kind of didn't really know what happened. I'd explained that I wasn't feeling well. And then the following day, kind of was resting up, took a COVID test, waiting for the results. And then that night, I was getting ready to go back to bed, and I had another episode of syncope where I had passed out. And at this point, my wife is very concerned because this is very unusual.
Brad, for the uninitiated, what is syncope?
Syncope is just the word of passing out. It's just a condition of passing out. That's the medical term. And by the way, I had to learn what it was once I went through it. just like an aneurysm, I had to look it up.
So you're fainting. You got fainting. That's not a good sign.
No.
And then what happens?
So at this time, it's Monday night. It's 9:30 at night. We're very concerned. I still don't know if I have COVID, so it's kind of awkward because I can't really interact. I can't drive myself to the hospital because of this fainting or the syncope. I don't know if I have COVID, so nobody else can drive me there. It's really kind of a lot of uncertainty. So we called the ambulance to come get me. I was coherent. I was fine. It's just all these things going on. So we headed off to the local hospital, which is part of the Cleveland Clinic. And naturally, they said, when you pass out, there's two issues. One is it could be electrical. You think of seizures, and the other one could be some sort of blood flow issue. So they gave me a CT scan to see if they could figure out what's going on. And that's when they discovered the aneurysm.
So, all right, pause for a minute, because you just happen to live down the road from Cleveland Clinic, the #1 by volume aortic center in North America. And it happens to be just down the street from your house. And that just happens to be where the ambulance takes you to.
Yeah, well, I was at one of their kind of branch hospitals, but you're right. When you're in the clinic, that is their expertise for sure. So I had, in hindsight, I had the best of the best care, other than at the time I didn't know what an aneurysm was, and I certainly didn't understand. I knew Cleveland Clinic was certainly exceptional at cardiac care, but I couldn't have understood what you said, Jack, how good they are at aneurysms as a specialty. That's really what they do as well as anybody.
And it's also, you also experience symptoms. And many of us in the aortic community, before things get really bad, some of us have no symptoms, or certainly for aneurysms. So you were a little unusual in that respect.
Yeah.
How did you end up getting a CT? Like, that's not typical, people's typical experience when they show up with fainting in an emergency room.
Well, and when they got the CT results, the doctor was a little bit, he was trying to connect the dots because, an aneurysm is kind of expanding. You wouldn't typically have symptoms of feeling faint. That's kind of not really, you would expect that more with blockage or some other type of cardiac issue. And so they were trying to connect, why was I experiencing the syncope and the passing out versus this aneurysm, what they found. And what they concluded was that the two are unrelated. The passing out, I was dehydrated. I did not have COVID. I think in hindsight, maybe I had food poisoning or something. So I was very dehydrated. And then the anxiety of COVID happening kind of accentuated the problem with the sinking of blood pressure and things like that. So they put me on an IV to get my fluids back up, and that kind of solves that syncope issue. But they guys said, hey, you get to stay the night because we've got some testing to do on you tomorrow. And that's when the harsh reality hit of I've got a really big problem that I didn't know anything about.
So you can thank COVID and thank being dehydrated. Maybe you went for a run and didn't hydrate properly. I don't know.
Yeah.
Something completely unrelated to
Yeah.
what you ended up getting diagnosed with. So what did they find?
Say that again, Jack. What did they?
What did they diagnose?
Oh, so it was. I ended up having a ascending root aneurysm at 5.2 in size, and that was on Monday when they diagnosed me. So I spent the day. They did an echo and all the traditional testing to just verify. And the clinic's very, very thorough with all their imaging. So they do a lot of work to make sure they get everything just right. And then with that, they sent me home and said, don't lift anything over 25 pounds. And, we were kind of, at first, the recommendation was to come back in and watch and wait, come back in 6 months. We'll see what happens. And the fact that I was over the limit and kind of an active person, that really didn't feel, it was not the place that I wanted to go, because I was very active, and it almost seemed like a death sentence to be sitting on the couch wondering if this is my last day, So we pushed a little bit, and then they recommended that I work with Dr. Svensson at the clinic, and they sent a note into his office to have them call me.
So
what was your time frame whenever you were diagnosed and you're trying to, like, how did you even prepare for that? And what was your thought process going forward once they were trying to prepare you for surgery, and how quickly did that come?
Yeah, it's a good question. So Monday I was diagnosed. That first week was very rough because I'm trying to understand what my life would look like having to go through surgery. I actually didn't know if I was going to have surgery at that point, just trying to understand what an aneurysm and what that would mean. Dr. Svensson's office did call on Friday of that week. And I do remember the call explicitly because the nurse, I don't remember her name, she said, I'm calling from Dr. Svensson's office, and we're just calling to schedule your surgery.
And by the way, can you just stop for a second? Who is Dr. Lars Svensson?
Well, Dr. Lars Svensson, as I've come to learn, is a world-renowned surgeon for aneurysms, and he was the head of the Miller Heart Institute at the clinic, and he retired in the last couple of years. But when I went to see him, he has performed over 3,000 heart surgeries. And the specific issue I had with the aneurysm, putting the valve back in, he had done that 1,400 times. So he certainly was he was an expert in the field.
So
right place at the right time and the right hands.
Yeah.
Yeah. You just happened to be a couple miles from a Cleveland Clinic hospital. And then they happened to assign you to, one of the most renowned aortic surgeons in the world, probably with the highest amount of surgeries.
Yeah.
You're a lucky guy.
Well,
you probably didn't feel that at the time.
Well, I consulted with a family friend who was a vascular surgeon at the clinic. He was one of my first calls after I was diagnosed. And that was what he pointed out to me, Jack, right away, is he said, well, there's some good news and some bad news. He said, the bad news is you're going to have to deal with this. He said, the good news is you're in the best place in the world to have to deal with it. And you've got the best surgeon that's right here. And he takes on patients that he will get you fixed up. He's the best of the best. And so the vascular surgeon had sent a note to Dr. Svensson. The order had already been placed with the hospital there. So everything had kind of led to Dr. Svensson's office now connecting with me and figuring out what was next.
So how long a period of time did you have from ER room until surgery?
So it was 4 days to schedule surgery. Then they gave me two options, Jack. They said, you can come in 2 weeks or you can come in 6 weeks. I wasn't in the headspace to go in 2 weeks. So I took the 6 weeks. So I went in on May 17th. I had 6 weeks to think about what was ahead of me, which was really difficult.
Yeah. How did you prepare for that?
You know what? It was tough. It was really intense. Everything about it. I had never had any major surgeries. I had never, outside of being diagnosed, I'd never spent a day in the hospital. my blood work, everything had been really pretty typical. No surprises. So for me, it was really out of my anything I could reflect back on as far as experiences in life. It was crazy, you know.
And any family history?
No family history. We've always had good hearts in the family, and nothing like this.
So you're preparing for an open repair. During that 6 weeks, here's my question. Did you go for a run?
No running.
No running.
No running. They said, take it easy. And ironically, 2 weeks after I was diagnosed that was the time I had to register for the Boston Marathon that year. And so I did not register with the idea that I was going to run it. I just wanted my email that said I was accepted. And I was trying to figure out if that was rational.
So the doctor called you to schedule surgery, and you got online and went and registered for Boston.
2 weeks, a few weeks later, I said, well, I really didn't know what my life would look like after surgery. Boston had made some accommodations that year that if you had to drop for medical reasons, they would essentially give you a refund, which was different than prior years. So that really allowed me to say, hey, I'm going to put my name in the hat because I really have nothing to lose. And even if I just get accepted, that alone, for people that qualify for Boston, getting accepted is a big deal because that's the difficult part, is qualifying.
All right. So you registered for Boston as a philosophical gesture.
Yeah, there you go.
To have a letter you could frame over your desk or
That's
sit
it.
at home
Yeah.
or something like that. And in a couple of weeks, you're going in for open heart surgery.
Yes.
And did you tell your wife that you had registered for Boston?
I did, but I don't remember how I framed it, but I think it was, I want my letter. I think it was more about getting my letter than running the marathon.
All right. Okay. And then, so flash forward, you have open heart surgery. And what do they do? What does Dr. Svensson do?
Yeah. So it's, essentially the David procedure. So they cut out the root aneurysm. They did salvage my valves. So they were able to put my valve back in and, checked everything else out. I had no other issues. So that essentially, repaired the problem.
And did you have a aneurysm on the ascending as well? Was that 5-2 on the ascending, or was it?
Yeah, 5-2 on the ascending on the root. Yeah, no other issues. The arch was fine. The descending, everything was fine.
Okay. And what was it? What was it like coming out of surgery?
Well, it was a wild ride. Anybody who's been through it. I went out on Monday. Obviously, when I was waiting for surgery, I couldn't believe I was there. It was just surreal, thinking about how I got there. And the next time I woke up, it was in the afternoon coming out of surgery. My wife was there. They still had a lot of COVID restrictions, so you couldn't have a lot of visitors, but I was in the cardiac ICU, and I spent a week in the hospital. I had a few complications a couple days in, just some bleeding that they were watching. And then I kind of got tangled up in the weekend. So I really didn't get to go home for 7 days, but the care I got was excellent. It's a tough process, but they took good care of me.
What do you remember about the recovery process during that time frame? I know a lot of times people will have to, they may get up and walk in the first couple of days. They may take a little bit longer. How long before you were able to get up and around?
They moved me pretty quick. I want to say within the first day or two, I was up on my feet, but I was pretty discouraged, to be honest. I thought because I was an athlete and because I, kind of as a runner, you kind of develop a certain amount of grit that I would hit the ground running. I wasn't naive about it, but it was really difficult. So I remember when I was at day 6, I kind of got all the IVs and everything out of me, and I thought that would be pretty freeing to be like, all right, I'm kind of on my way. And I just felt pretty broken. And the thought at that point I wasn't thinking about running a marathon. I was thinking, can I, walk 100 feet? It really was like starting over. And I couldn't believe how it was kind of rock bottom. It just really felt like I got a long ways to go.
Well, they did crack your chest open.
Yep.
you had the heel
that.
sternum.
Yeah, there was.
I don't know if anybody mentioned that. you know, and I don't care how much marathon running you've done.
Yeah, it's a little tender. So I
So
headed
when
home.
after, go ahead.
So I did, yeah. So anyways, I did home. I think I headed home on, I think it was May 24th. It was a week later. And I was thankful to be going home, but I had a long road ahead of me, that's for sure.
Long into that before you asked the cardiologist about running, and what role did he play in moving forward with that idea?
Well, at this point in my recovery journey, the marathon was kind of something I kept to myself. This was not common knowledge. I really will say this: when I got home from the hospital, I hadn't ruled out the marathon, but I really was like, I don't even know if that's even possible. And so I just kind of set that to the side, but I didn't want to do anything that was going to disqualify my chances of potentially doing it. But I really didn't know if it was possible. I mean, I'm trying to walk to the end of the driveway to the mailbox, and the thought of running 26 miles was pretty out there. So that's how that proceeded. But the other thing that happened is in the following weeks from surgery, I had some follow-ups, and you start talking about cardiac recovery. They started talking about that. And I knew one thing's for sure, that if I got into a traditional cardiac recovery plan where you go to the hospital and walk on a treadmill for 12 weeks, there would be no marathon. And so I had expressed to them that I was a runner and that I was very familiar with working out, training plans. I knew my heart rates. I have a treadmill at home. And so really asked, was there some other option besides traditional cardiac recovery? And at that point, being the clinic, they said, we do get some people like yourself who are athletic, and they recommended that I see a sports cardiologist, which was Dr. Singh. So that's kind of how I started to veer away from the traditional kind of cardiac recovery to something that was a little different.
Yeah, and as I recall, during COVID, I think we may have been in cardio rehab at the same time.
Yeah.
In separate cities, but a lot of it was remote, and it was
Yeah.
very discombobulated at the time because of COVID.
Yeah.
So how did you get connected with the sports cardiologist?
Well, so I asked about my options, and they recommended that I see her, but the schedule to see her wasn't until week 9. And so the first week I was in the hospital, obviously with surgery. The following 5 weeks, I was just able to walk. They said no running, but just walk. So I started day 1 walking to the end of the driveway, then the corner, and progressed pretty quick. By week 2 or 3, I was up to about 10 or 12 miles a day. And
whoa.
Yeah.
How quickly?
Probably 2 or 3 weeks out, I was hitting about 12. I think in my first 6 weeks, I walked about 140 or 50 miles, maybe, if I had to guess.
I think that's incredible. There's still a lot of people who, whether they go through an aneurysm repair or a dissection and repair, that sports cardiology is not even brought up. They may go to a regular cardio rehab, but maybe, even if you mention about running, not everyone gets that opportunity about sports rehab, let alone trying to work up that quickly. I mean, that's just, wow. I don't think I've heard of anybody who's worked up that quickly after a repair. That's just awesome.
Yeah. And I was, at this point, I mean, I hadn't gotten a lot of direction other than they said you can walk, make sure you watch your heart rate. They encouraged me to walk. They did not say hold back. They obviously said keep your heart rate under control. And so I would walk, usually in the morning, I would take a long walk that would be a couple hours, whatever. And then throughout the rest of the day, I would take some shorter walks. And then obviously that over time progressed, the durations got longer and the paces got quicker. And that took me up until week 6, when at that point I was able to go back to work, and saw the general cardiologist, who said I could start to run, but I would have to keep my heart rate under 140. And so then it kind of started.
That's what I was about to ask next. What the heart rate target was? 140.
Yeah. No, yeah, not over 140, which was once again like starting all over, because as good as I felt walking long distances at a good walking pace, running was like starting all over. I was running maybe 13, just a hair faster than walking, 13-minute miles maybe, and maybe 3-4 miles at a time. So I couldn't run near as far as I could walk, and it was definitely a next level challenge.
So how did your family react to you starting to do up to that 12 miles? And I mean, were they nervous, or were friends and family trying to hold you
Uh,
back, or what was going on there?
no, I think on the walking side that I think the walking was within a comfort zone. I think the running started to get a little bit out there. but but so what happened is at week 6 I started to run. I don't remember. I was doing something every day, but I was probably running 6 days a week. But it was 3-4 miles at a pretty reasonable pace, watching my heart rate. And I did that till week 9, and then week 9 is when I got to see the sports cardiologist, Dr. Singh. And so that's when I knew that it was kind of, if I was going to do the marathon, this was going to be kind of the conversation I had to have with the cardiologist about, was this reasonable? Is this possible? And kind of either go for it or decide that this was just a crazy idea that wasn't safe.
So somewhere on those long walks, you started to germinate about that this Boston could even be a possibility.
I hadn't ruled it out. I didn't know. I mean, normally if I was training for a marathon, 20 weeks isn't uncommon. So that's under good circumstances. So I still didn't know, Jack, if I could even without the heart surgery, just trying to cram it all in. I was just running out of time.
Brad, had Boston set a date for the marathon? Because it was COVID, and usually it's on Patriots Day,
Yeah.
around Easter. And when did it occur that year?
They had scheduled it for October 11th. So
Okay,
they had
so
come up with an alternate plan in the fall. So if you counted, I had essentially had 21 weeks from surgery to marathon. And like I said, the first 6 weeks was walking, and then it was 3 more. So week 9 was when I really was able to have an honest conversation about, hey, can I run a marathon at that point in 12 more weeks?
And what's it like going to a sports cardiologist?
Well, I liked it. What I found was the first thing that she said was, how are things going, and tell me about your background. And what I told her was, I said, I feel like I'm doing pretty well, and I feel like I could continue to be challenged, and I'm ready to be challenged, but I don't want to do anything that's going to hurt myself. And my wife was with me at this time, and I kind of said, well, and I kind of have this other goal, and and I said, I kind of would like to run the Boston Marathon because I qualified, but I don't know if I can do it safely. And she looked at me and she said, well, I did my medical training in Boston, and I work at the Boston Marathon every year in the medical tent. So right then I knew that I at least had someone that understood the passion and why running the Boston Marathon is a big deal to runners. So I didn't have to explain why that was something that was important to me. But she did say, well, let's talk about what your goals are. And I think this is the part that was pretty interesting, because she didn't say no, but she really wanted to know, what did I want to get out of doing this? And what I expressed is, I just want to celebrate recovery. I don't want to say records. I want to participate. And I want to do it safely. That's my goal. And so with that, she said, I think you can do it, and I'll help you develop a training plan to get there.
So you had Dr. Svensson, and your sports cardiologist works in the medical tent at the Boston Marathon.
Yeah, go figure.
And
All
she
the
said
stars
she
aligned
thought you
for
could do it.
Brad.
Yeah, that was a good one. I was like, all right, now I got someone on my side.
So did they do an exercise stress study to see what your blood pressure does when you're running? What did they do? What kind of test?
So what we did is, so starting at week 9, she said I could start lengthening my mileage a little bit. Still wanted me to, I think, if I recall correctly, still wanted me to watch my blood pressure under 140. And then she said in mid-August, which would have been 3 weeks later, I could start running the first half of my training runs by blood pressure, the second half by perceived exertion.
By blood pressure or by heart rate?
Oh, I'm sorry, heart rate for the first half, and then the second half would be like perceived exertion. So, the blood pressure or heart rate would say one thing, and then if I didn't pay attention to that, I just ran in a level that I felt comfortable kind of how did that feel, and starting to develop a sense of how that would feel. And at this point, I'm starting to add miles on. So because obviously I had to get, if you take out the time to kind of taper for the race, I probably had 9 weeks to train, I guess, to get up to my longest run. I did one long run at 20 miles, and that was the plan with Dr. Singh. And so 4 weeks before the marathon, we did a stress echo just to make sure everything was healing up properly. And that was kind of all my training was kind of leading up to that 4 weeks before the marathon to say, okay, was my body responding? Was there anything that would be concerning? And so I did the stress echo, and everything was clear.
So essentially you ended up moving away from the numbers per se to just how you felt.
Yes. Yeah. Over the training period, that's exactly how it happened.
Yeah.
And was the perception like able to carry on a conversation, or what was the level of effort that you were perceiving?
Well, since I was doing a lot of long runs, I obviously wasn't doing sprints or anything. So I was really probably focused more on endurance, Jack. And so the challenge that I found is I was still taking the beta blocker at the time. And so that was changing my heart rate by about 10 to 15 beats per minute. And so it was a little funky to try to understand how I felt and how I was fatiguing. And then when you look at your heart rate being lower, and you'd say, this doesn't quite line up. Towards the end of my training, I actually did not have to take the beta blocker. My heart rate went up, but then it kind of matched well with my perceived exertion of what I would normally experience for a long run or something. So it started to kind of all come together. Still not back to where it was, not back to where I was pre-surgery by any means, but I started to get a sense of what my abilities were, at least at that point.
Wow. So whenever you're going to the sports cardiologist and trying to figure this out, are you going every week, or how did the reporting back of this go with the doctor?
No, I just saw her. I saw her once, third week in July, and then I had that follow-up in early September, the stress echo, and then that was it. And then the next time I saw her was at the marathon.
Oh, that's pretty cool. Next time you saw her was at the finish line.
Yep.
All right. Well, take us through Boston.
Well, Boston was great. The weather was exceptional that year, and just to put it in context, I didn't book an airline flight. We drove there, and we planned last minute because I didn't know if we were actually going to go. And so when I finally got cleared 4 weeks before the race, we literally scrambled to find a hotel. We hopped in the car, and that's how we got there. And so went with my wife and my son, and my sister from New Jersey joined us, and my niece goes to college in Boston, so she was there too.
And what kind of a pace are you going to set?
Well, that is a great question. I had no idea what I was going to do. So
because most inexperienced runners go out too fast, they die on Heartbreak Hill, and they walk the rest of the marathon. I mean, that's sort of the Boston Classic experience.
Yeah. So what happened there was I had a few friends from Cleveland that were also running. I knew that they would be running faster than I was. I dropped back a number of groups because I'd qualified at one time, so I wasn't going to run that pace. And as I was starting the race, I met some other people along the way, and it turns out there was another runner who had kind of been injured before it. So we ended up running the whole race together. And that kind of took my mind off of pace and just said, you know what, let's just enjoy this. And I ran a 4:45 for the Boston. I don't know what the pace was. I didn't really think about it too much. All I wanted to do, Jack, was run across the finish. I didn't want to crawl or,
Brad, I just want to say, when I was a college student in the late 70s, I went to Boston College and would hand out beer at the top of Heartbreak Hill to runners. Did anyone hand you a beer?
They would have gladly given me whatever I wanted.
So how did your family feel when you were out there? You said that you're meeting somebody to get your mind off, but how did they feel waiting for you to come to the finish line?
I'm sorry, Carmen, that cut out a little bit.
I think she's Carmen, you cut out a little bit. I think she was asking just how did your family feel out there?
Well, they were nervous, I'm sure. Um, and so I tried as I was running. I was sending some texts as I was running just to my wife saying, "Hey, everything's going well," trying to assure that if my pace was slowing down, it wasn't because anything was happening. It was just me. I didn't really. Once I got running, I had no aspirations to try to push myself to the limit. I just wanted to keep running and enjoy the experience. So I would send text, and then she was waiting at Boylston Street at the last half mile with the family, and that was fun to come around the corner and see them.
Not bad. Tell us about crossing the finish line.
Well, it was amazing, So I get across the finish line. I pick up my medal and I said, "Oh, I'm going to go to the med tent and say hi to Dr. Singh and thank her for her help." And I walked over to the med tent and I said, "I'd like to see Dr. Singh." And then I told him, I said, "I'm not having any medical problems. I just need to catch up with her." And they kind of looked at me like this isn't social hours, so they didn't accommodate right away. And then I said, "Well, they said, we really can't do that. We have 60 people that are working, to help with medical issues." And I said, "Well, if I told you I had open heart surgery 5 months ago and she was my cardiologist, would that make a difference?" And the guy looked at me and he said, "Well, that's amazing. Let me see what I can do." So he turned to another doctor and said, "Do you know Dr. Singh?" And the other guy said, "I know Dr. Singh. I'm the one that trained her. I'll be right back." So he went and got her, and then she came out, and we took a picture together and thanked her for her time. And she'd been tracking me on the Boston live track app, so she kind of knew I was in the area. But it was really fun to see her and to thank her for her work.
She had a little skin in the game too.
Yeah. Well, she was also a runner. She'd run a number of marathons herself, so she loved Boston. She loved running, and she's obviously do anything to help her patients.
Carmen, I think we're getting a little interference from your microphone for some reason. Maybe you can check that. Joshua, do we have any questions?
We have a quiet chat today. Let's say hi to Velda. Hi, Velda.
Well, while maybe people are thinking if they have questions, Brad, what post Boston? Do you have goals? What's changed? What's the same?
Yeah, so I did run another marathon. I ran Chicago a year after that. At that point, I was starting to get back to more normal. I do think that even though I had a good recovery post-surgery, it still takes about a year, I think, to really start feeling like yourself. And so I would never tell anybody differently that there's a healing process. It takes time. And so I started to, about a year later, start to really feel kind of back to myself as far as running. Did run Chicago. And I still continue to run on weekends with friends. I don't know that I'm going to be doing too many more marathons. It's a tough sport. But, obviously my plan was to run 2 marathons. I did 4, and I'm pretty happy with that.
And what would your message be to people who are in watch and wait? So we get a lot of questions on aortic athletes from people who join. They've gotten a diagnosis like you did. They might be at 4.0, 4.5, 4.7, whatever. And they think their exercise life is over.
Yeah.
What would you say to them?
Well, I wasn't in that area for very long, Jack. So I was very fearful of the watch and wait zone, because I felt like, what would my life look like? So I probably have a better opinion about what is life post-surgery, as far as how that affected me. But I would say this, I'm a big advocate of sports cardiology. I think I had a good experience with it. And my experience was that general cardiologists are very equipped to take care of issues that we would address, but maybe don't understand the mind of an athlete. I had a lot of people that tell me, "Hey, you can do Boston another year and take it easy," and they meant it in good spirit. But I think as athletes, our kind of fight or flight is to say, "Hey, I feel best when I'm out being active, challenging myself and all that." So I have a lot of sympathy for people in the watch and wait area. I only had to do it for 6 weeks, but that's a challenge because I know I was not wired to sit back. I wanted to go out and be myself and be athletic. So I would recommend, if you can find a sports cardiologist, they may add some insight into what might be reasonable, what might not, that might just allow you to reflect on that and how to do different sports safely. Maybe they might be a little more open to hearing your thoughts and talking through that.
Yeah, that's great. Carmen, are you back with us?
Can you hear me okay now?
No, you're kind of wonky, Carmen. But Brad, also, I think Carmen and I both dissected.
Mm-hmm.
And I think we probably have a different trajectory from someone like you who's had an aneurysm that's been repaired with no dissection.
Yes, for sure.
And so Carmen and I are probably your first miles running were 13-minute miles. Those are my current minute miles.
That's right. Yeah. Yeah.
Or 11. I think I was 11 and a half today on a 4-mile jog, which I was proud of. I was happy with.
Yeah, that's good. Yeah, it definitely is. I mean, I would say you're right. Watch and wait is certainly one aspect. People like myself who were repaired and did not dissect, obviously that is good. I mean, I was able to catch things before it was a problem. And then obviously dissection, people like yourself, is a different animal. I know I did when I was diagnosed, I did kind of look and found some professional athletes that competed at the highest levels who had aneurysm surgery successfully, proactively, and did not dissect. And then they had careers that went on and at the highest level of athletics. So that I found a lot of encouragement to know that if I get repaired, I should be able to continue to do what I like to do.
Yeah. Joshua, checking back with you. Any questions?
Right on. Velda says, Brad, you are amazing, and I love your story. And
thanks.
Our very own president, Karen Anderson, jumped in to say, thank you for sharing. Very inspirational with a big, giant red heart. And I have a question for you, Brad.
Sure.
How often did you have to mess with your medications as you were going through recovery, other than you said the beta blocker?
Well, it was interesting. Only twice. The first day I took the beta blocker, I got a terrible case of double vision, which was really horrific. It didn't last very long, but it was not good. And so I called the cardiologist and said, I'm on a light dose. I don't remember what. I think it was 25 milligrams a day or something, but they cut it in half because I was going too low on my blood pressure, and that was causing that double vision. So they adjusted it, and I really, to be honest, couldn't wait to get off of it. It didn't really affect me too much day to day, but I just felt like I wasn't as in tune with my body being on the beta blocker, and but I didn't have too many problems outside of that.
Okay. Yeah, I think getting the level of your meds right is it's an ongoing thing. It's not a one-time deal that we sort of finish up on. I'm just reducing my amlodipine from 10 milligrams to 5 after seeing my cardiologist the other day. So you're one of these people. Are you on meds now?
No, I just baby aspirin every other day.
And when you take your blood pressure, where's it at?
I mean, typically I've been 120 over 80 has been typical. I think in the last year I've been a little bit higher, but I've not typically had high blood pressure. It's always been pretty controlled.
Wow, that's amazing. And I think that's a difference too from people who've dissected versus people who've had a repair like you, is the ability to keep your blood pressure maybe easier in check without the meds. I think those of us who've dissected, it's just part of the deal that we live with.
Yeah.
And that's great. And our friend, Dr. Siddharth Prakash, who we always give a shout out to, he's fond of saying that a recent study showed that you can reduce your chance of dissection by 50% by keeping your blood pressure under 120 over 80. So that's definitely a message that we hear from all of our cardiologists these days. Yeah. All right. Well, Joshua, do you have anything else?
The chat remains quiet, sir.
Okay, great. Well, Carmen's got an audio problem. I was late, or I had technical issues at the beginning. Brad, you are. By the way, can I thank you because you were out in New York
Yeah.
this past November when I did. And Carmen was lucky enough to do the marathon for the John Ritter Foundation, and maybe one day we'll entice you to dust off your shoes and run for Ritter at the New York Marathon. Who knows?
I think I like spectating better. It's a lot easier.
Spectating, it's a lot more fun, and you can drink more and all other things like that.
Jack, we had a great time chasing you all over town. It's Carmen, myself, and my son. We were all over the place. It was great.
Well, your wife and your son are beloveds, and this is such the unexpected thing of having aortic disease is finding this community. Yes. People like you, Brad, Way are part of it. So thank you for joining us tonight. Thank you, Carmen. We'll get your microphone fixed quickly. And thank you, Joshua, and thank you all. And we wish you all a good night.
All right. Thanks.
Stay on, Brad.